Hi everyone, welcome back to my channel. My name is Matthew Fayisa and I'm a third year medical student from London. In this video, I'm going to be covering Alexandre Lacazette's injury and looking at the medical side of it. Alexandre Lacazette got injured in a pre-season game against Lyon where Arsenal lost 2-1. In this game, against his old side, Alexandre Lacazette injured his left ankle and can be seen wearing a brace once leaving the stadium. Arsenal manager Unai Emery reassures Arsenal fans, however, that this is a minor injury and a minor sprain to his ankle. As a result, he most likely will be rest for the rest of the pre-season, but should be back for the season opener against Newcastle in the Premier League. Before we get into the anatomy of the ankle and describe how the ankle sprain occurred, if you like this style of content, make sure to subscribe so that you don't miss out in the future. And also, once this video is finished, go look at our Marco Asensio video where we talked about how his season-ending injury occurred with the ACL. Alexandre Lacazette had a mild ankle sprain which forced him to leave the Emirates Cup game just after a few minutes. An ankle sprain is an injury to the ligaments which are responsible for connecting the leg to the bones in the feet. An ankle sprain can occur as a result of sudden twisting or turning and landing in an awkward position on your ankle. This results in the ligaments being torn or strained. All ligaments, regardless of where they are in the body, have a specific range of motion which allows them to keep the joint stable. As a result, when these ligaments are pushed past these boundaries, all stability, and in this case the ankle, is lost. Sprained ankles most commonly involve ligaments that are damaged outside of the ankle. In addition to this, even though this injury is reported as a mild sprain, it could be a cause for concern because Lacazette previously had a knee injury which resulted in him missing 8 games for Arsenal in his first season. The reason this could be a concern is because, say the ankle is less stable, other parts of the body or the leg in particular will start to overcompensate. As a result, this could put excessive strain on the knees, which have been previously injured, and potentially the hip, and as a result, re-aggravating any further injury that he's previously had. Sprained ankles are very common, so we've probably all experienced some form of ankle discomfort in our lives whilst playing sports. If you have a sprained ankle, you typically see quite a typical set of symptoms. These can range from inflammation to stiffness, swelling, bruising, pain, and most iconically, an inability to put weight or walk. This is the reason why you can see Alexandre Lacazette walking out with an ankle brace, as probably post-injury, he's going to be finding it really hard to actually put any weight on that ankle. If you have an injured ankle, a doctor will perform a certain amount of tests on you, and as a result, it's pretty much certain that Lacazette would have been assessed by a club doctor immediately after his injury. In addition to these tests, it's also likely that they carried out a few imaging tests, such as an MRI or an X-ray, just to get further down and diagnose this properly to make sure that it was actually just a mild sprain and not any actual fracture caused to the bone and the integrity of the ankle. Treating a sprained ankle is all about promoting recovery and increasing time for it to heal properly. As a result, using the RICE strategy is most commonly promoted. This involves R for rest, I for ice, C for compression, and E for elevation. These 4 methods are most commonly used in the immediate aftermath of an ankle sprain and can help promote recovery. In regards to surgery, because Alexandre Lacazette had only a mild sprain, it's very unlikely that he will actually need it, and it wouldn't be actually advised that he would. These would only be used for grade 3 sprains where there's actual torn ligament and the structural integrity of the ankle is damaged. In addition to this, to reduce the weight on the ankle, walking aids would be used, such as crutches or braces, and these would be used pretty much for at least a week or 2 before the ankle can become actually manageable and re-heal itself. With this video now over, comment down below what other players and injuries you would like me to cover in the future. I'm thinking of doing an NFL player called AJ Green, who recently had an ankle sprain like Lacazette. However, unlike Lacazette, he had a grade 3 sprain where he completely torn off the ligaments from his ankle, and as a result is more serious. Apart from that, if you like the video, make sure to subscribe before you leave so that you don't miss out on any content in the future. And thanks for watching.
Hey. They don't call me the up in the east, that's where they rule the streets, that's where they catch a case for some jewelry, I swear. If you wanna test it, you think that it's sweet, I dare you to survive in the belly of the beast. I'm fearing that the likelihood that my brothers could meet their makers is high, so